Hi y'all, my name's Taylor and today I'm going to be talking to you guys about aging adult health and why it is so important to us. So first off, I'd like to just go ahead and define for y'all what exactly an aging adult is. The term aging adult refers to adults that are simply aging. The number of adults, or the number of Americans aged 65 and older, is projected to double from 46 million to more than 98 million by the year 2060. So our population of aging adults is going to be increasing rather quickly, and this is mainly due to our increase in life expectancy. So as you can see, the life expectancy of a man is now 84.3, and for a woman, it is 86.6. Um, as people are living longer, our population of aging adults is increasing. As far as health goes for aging adults, they are at a higher risk for health problems and chronic diseases like heart disease, cancer, strokes, and diabetes. According to healthypeople.gov, 60% of older adults have at least one chronic disease. And this is important because chronic disease accounts for 75% of the money that our nation spends on healthcare. Another huge health concern for aging adults is obviously falls, which can result in mobility impairment or even death. HealthyPeople.gov also states that every 13 seconds, an older adult is treated in the emergency room for a fall. And sadly, every 20 minutes, an older adult dies following a fall. So falls are important because they can lead to fractures, hospital admissions, injury, or even death. So it's definitely something that we have to pay attention to in this population more so than in other populations. The U.S. Census reports that 40% of people aged 65 and older have at least one disability. And we'll talk about later how mobility impairment contributes to the total number of disabilities in older adults. And lastly, mental health, cognitive impairment, and substance abuse are health concerns, seeing as though depression affects nearly 7 million older adults. And 2/3 of older adults with mental health problems do not receive the treatment that they need. This is another concern that's important when dealing with the aging population because mental health, as we all know, plays a large role in our overall health and well-being. HealthyPeople.gov has a list of 15 indicators of older adult health that include topics ranging from obesity, current smoking status, medication for high blood pressure, mammograms, vaccines for the flu and pneumonia, mobility, and more. A few that are important to the realm of health policy are the first, second, seventh, and 12th, which respectively deal with the the following topics. The first one sets to increase the proportion of older adults that use the Welcome to Medicare benefit. The second aims to increase the proportion of adults who are up to date on a core set of clinical preventative services. The third sets out to increase the proportion of healthcare workforce with geriatric certification. And the last one, the 12th one, sets out to increase the number of states that make information public regarding characteristics of victims, perpetrators, and cases of elder abuse, neglect, and exploitation. All of this information can be found on the healthypeople.gov website under 2020 objectives for older adults. So now I'd just like to talk about why aging adult health is a concern for us as a society, and why we should care about it. And it essentially all boils down to the notion that gerontology, or the study of the process of aging, represents the future of healthcare. According to the American Psychological Association, or the APA, the U.S. population, this is a statistic that I said before, the U.S. population is aging extremely rapidly, and it is predicted that by 2060, more than 98 million Americans will be 65 years of age or older. So it's important for us to focus on how we can limit the impact of diseases on older populations to improve their life expectancy and their quality of life. This will be the first time in history that the number of older adults outnumbers children under the age of 5. So now that we are living longer, healthcare providers, researchers, and policymakers are now focusing on ways to improve the quality of life of our later years. There's also an economic incentive as to why aging health is so important, because seniors are and always will be the heaviest users of healthcare. More than 2/3 of current healthcare costs are for treating illnesses among older Americans. So it's important that we address ways to reduce risk of developing these health issues so that we can decrease our economic spending on them. There are a number of things that the American Psychological Association recommends doing so that you can quote unquote age well. The first is a moderate amount of exercise every day, which can help an older adult stay active and independent and increase their mood to make physically declining people stronger. A healthy lifestyle and making adjustments for any observed changes in hearing, vision, flexibility, and strength. Engaging in routine preventative health behaviors is important, as we saw in the elderly vaccines presentation, because getting immunizations for flu and pneumonia is part of aging well. Advocating for your health care is important when determining health decisions, so seniors shouldn't be afraid to get a second opinion or ask questions when it comes to making decisions about their health care. Lastly, we recently discussed that health risks for older adults include anxiety and depression, so the APA encourages those who are struggling with that to seek the help that they do need. The Office of Disease Prevention and Health Promotion through Healthy People campaigns outlines multiple determinants of health as a generality of adults in our population. For this specific population of aging adults, I'm just going to focus on these last four because they play a little bit of a different role when we're older than they do when we are younger, as we rely on different resources. So obviously, we talked about age and how older adults are at an increased risk for other health concerns. So now I'm going to talk about disability. As we discussed, older adults are at a very high risk of falling and hurting themselves. So it is no surprise that the United States Census reports mobility as the most common disability among older adults. For socioeconomic status, many senior citizens rely on Social Security, SNAP, and other government benefits to live on and purchase their medications. Unfortunately, our current administration seems like they're doing everything they can to make it harder for seniors to live through wanting to repeal the Affordable Care Act with no replacement, reducing Social Security, and reducing SNAP benefits. For geographic location, access to healthy foods for maintaining healthy lifestyles, availability of community-based resources, sidewalks and safe neighborhoods for exercise are all important parts of the geographic location and environmental factors that determine our health when we're older. The Affordable Care Act was signed into law in March of 2010 and helps senior citizens in a multitude of ways. The first is through decreasing the burden of prescription drug costs on already struggling senior citizens on Medicare. Additionally, Medicare beneficiaries are now able to receive preventative services with no out-of-pocket cost. Information about how the Affordable Care Act helps seniors can be found on the website for the National Committee to Preserve Social Security and Medicare. The Older Americans Act is an act to provide assistance in the development of programs to help our senior citizens. This act was signed into law a long time ago in 1965 by President Lyndon Johnson and was recently reauthorized in 2016 to be effective through the year 2019. And this is important because it was the first federal level initiative aimed at providing comprehensive services for older adults and programs centered on community-based services, disease prevention and health promotion, and elder rights programs. Lila, shh. Currently, Aging Services of Oklahoma and the Department of Human Services contracts with 11 Oklahoman agencies to provide free services to older residents 60 years and older. Services include home-delivered meals, health promotion, nutrition education, in-home assistance, transportation, legal services, and much more. For the Affordable Care Act, with our new president in Congress, the health care gains made through the Affordable Care Act are facing a huge threat. According to Families USA, hundreds of thousands of Oklahomans stand to lose health care access. And almost 700,000 Oklahoma seniors rely on Medicare. Families USA also states that 1.6 Oklahomans with pre-existing conditions could be denied health care, and drug costs will go back up. So, as we see, 1.6 million Oklahomans, or 700,000 Oklahoma seniors, rely on Medicare. And we discussed earlier how the ACA, or the Affordable Care Act, decrease the burden of prescription costs for people on Medicare. So the repeal and not replacing that would be detrimental to our senior citizens. So, what else can we do? Not just in Oklahoma, but in our nation. The Healthy States Initiative outlines a few things that our legislators can do in terms of public policy in order to promote aging well. The first one is called Aging in Place, which means allowing the elderly more opportunities to live in community style housing or their own homes for as long as possible, rather than moving into nursing homes. And part of aging in place means developing walkable communities and increasing opportunities for safe, regular physical activities, as a lot of older adults may be more vulnerable to the influence of their residential environment. For situations when the elderly are forced to move into assisted living and nursing homes, healthypeople.gov states that we need to provide proper geriatric training and education to caregivers, professionals, and paraprofessionals. Another thing that legislators can do is promote the message that it is never too late for an older adult to adopt a healthier lifestyle by providing funding for communication campaigns targeted at seniors. Lastly, our legislators can broaden the use of preventative services through establishing statewide chronic disease self-management programs, improve the rate of immunizations, and supporting training of prevention-focused geriatric care for healthcare professionals. And these are the sources that I use. Feel free to go take a look at any of those websites. They provide a lot of great information, and I just wanted to say thank you guys for listening today.